Welcome to today's episode of Neuro News, where we break down complex, nervous and hormonal issues for the everyday listener and offer a refresher to our budding clinicians. Today's focus, Cushing's disease, a condition where the body makes too much cortisol, often due to a pituitary tumor. Cushing's disease is a form of Cushing's syndrome, caused specifically by a pituitary adenoma that overproduces adrenocorticotropic hormone, ACTH, which in turn overstimulates the adrenal glands to produce cortisol, our body's primary stress hormone. Over time, this hormone overload causes serious health complications. Common signs include weight gain, specifically in the face, neck, and trunk, purple stretch marks known as striae, fatigue and muscle weakness, easy bruising, mood changes, high blood pressure, diabetes, and irregular periods. How is it diagnosed? Diagnosing Cushing's isn't simple. The symptoms develop slowly and overlap with common conditions like obesity and depression. That's why your doctors use multiple tests to confirm the excess cortisol. The three key tests are late night salivary cortisol, done at bedtime to catch cortisol when it should be lowest, 24-hour urine-free cortisol, measuring how much cortisol is being excreted, a dexamethasone suppression test, where you take a steroid at night and measure cortisol levels in the morning. If results are consistently abnormal, doctors check ACTH levels to figure out the source. Is it the pituitary, the adrenal, or ectopic, meaning from somewhere else in the body? Pituitary tumors are often confirmed with MRI images, and if needed, a special procedure called inferior petrosal sinus sampling may be done. What are the treatment options? The first line of treatment may be surgery, usually transsphenoidal surgery, by an expert pituitary neurosurgeon. This approach has a high success rate, especially for small tumors. Other options include medical therapy, such as ketoconazole, metripirapone, or osilodrostat, especially when surgery isn't possible or if it fails. Radiotherapy, which can be used in select cases, and repeat surgery if there's a recurrence. What are the complications to watch out for? Cushing's disease increases the risk of blood clots due to a hypercoagulable state. Some patients need blood thinners before and after surgery. Heart disease and diabetes, requiring early and ongoing management. Bone fractures, even if bone density looks normal. Growth hormone deficiency, especially after surgery, affecting recovery and quality of life. How do we monitor for recurrence? Even after a successful surgery, lifelong monitoring is essential. Cortisol can creep back up years later. The late night salivary cortisol test is usually the earliest to detect relapse. What about in children? While it's less common in kids, Cushing's disease can impair growth. Treatment and hormone replacement need to be carefully tailored for normal development. So, in summary, Cushing's disease is complex, but early detection, expert care, and ongoing monitoring can dramatically improve outcomes. If you or someone you know has symptoms, don't delay and speak to a healthcare provider. Thank you for joining us today. Whether you're a curious patient or a medical resident sharpening your skills, remember, understanding Cushing's disease is key to managing it effectively. Until next time, stay informed, stay empowered, and have a blessed day.